Okay, so we have our 2023 case study for Grand Canyon University Chemistry 101 lab. My name is Angelica Rodriguez. I'll be your presenter. Any questions or concerns, please post. So we have our patient history here. We have both objective and subjective information. We'll go ahead and start with the objective first. So he's 25-year-old Caucasian male. Blood pressure measures 110 over 68. He's 6 feet and weighs 150 pounds. Glucose was measured to be 110 milligrams over deciliters, and we also have his urine analysis values. The subjective information is that he suffers from extreme exhaustion, follows a vegetarian diet, limits calorie intake to 1,700, and runs 5 miles every day. The treatment plan that we have in process would be to take a nutritional assessment, an exercise evaluation, and additional lab testing. So, given the patient's vegetarian diet for nutritional assessment, it's essential to ensure that they're getting adequate nutrition. We would provide a registered dietitian to provide them recommendation to meet energy needs. Energy needs moves us into a segue to the exercise evaluation. Patient maintains an active lifestyle. Evaluation by a sports medicine specialist can help ensure their running routine is appropriate and not causing the excessive fatigue or extreme exhaustion in this case. And lastly, lab testing. Further investigation of elevated creatine kinase and lactate dehydrogenase levels can indicate muscle or heart issues. We want to make sure that we're ruling out all possible disease or tired muscles, and that the patient is making a full recovery. Evaluation of tests. So we did 3 different tests. We did a glucose determination, and in my opinion, this was to rule out diabetes. We did enzyme kinetics to see how their organs are functioning, and then a urine analysis to see what the patient is excreting. So with glucose determination, we determined it was within a normal range. This could very much vary. So 120 is going to be an average blood glucose, and that's going to be fasting. An average blood glucose after a meal would be 180 milligrams per deciliter. The enzyme kinase, it was 2 different sides of the spectrum. So we had CK enzyme and LD enzyme. Now, our expected sample absorbance is for the CK enzyme 1,180, and our patient absorbed 3,105. That's a very high CK enzyme absorption. On the other hand, our LD enzyme was expected to be at 1,880, and it was found at 1,680. So that one was low. Lastly, our urine analysis. Our urine analysis showed that our specific gravity was high, our pH was elevated, the color was low, ions were elevated, ketones were low, and bilirubin were low. So we took this evaluation of test, and what we did was we critical thinked with them. So we go into detail a little bit more on what these tests really mean, what do these numbers really mean, and how can we continue treatment for this patient. So I want to start off with the glucose blood sugar. The typical fasting glucose is below 100, so that's considered normal. In this case, the glucose determination was of 110, slightly above fasting levels, but still within acceptable range. However, it's important to consider clinical information and the patient's overall health when interpreting this result. Urine analysis tests indicate several findings that have a clinical significance. So the specific gravity was 1.04, indicates that the concentration of solutes in the urine is high, and it can indicate that it might be a case of dehydration, kidney dysfunction, or other medical conditions. A pH of 8 is on the alkaline basic side. This can be associated with a diet rich in alkaline foods, or may indicate kidney or urinary tract issue. It's important to consider that the result of the context of the patient's overall health, elevated potassium levels in the urine. Elevated potassium is linked to kidney disorders, and the presence of bilirubin in the urine can be an indicator of liver or gallbladder issues. In this specific patient, there was normal amounts of bilirubin. But one thing that's important to remember is that urine analysis should be interpreted using the context of the patient's medical history and anything else that the patient might indicate you during the time of the test. Enzyme kinetics. So we're bringing back this table that we saw earlier. So the absorbent values that you provided for CK and LD measurements in the 15-minute period are indicative of laboratory tests typically associated with biochemical assay. These absorbent values can be used in spectrophotometry to qualify the concentration of the enzymes in a biological sample, to interpret these results accurately and determine their clinical significance. A technician should evaluate them within the context of the patient's medical history. Elevated CK and LD can be associated with medical conditions such as heart conditions, liver disease. However, interpretation of enzyme levels would involve using a patient's blood test as well. So our diagnosis for, let's call them patient 0, is liver and kidney disease. So here are some key points to consider. The liver and the kidneys are vital organs with distinct functions, responsible for detoxifying the blood, producing proteins, and metabolizing various substances. That's the liver. The kidney filters and excretes waste products and maintains fluid and electrolyte balance. Liver and kidney dysfunction can result from a variety of causes, including alcohol or drug abuse, autoimmune disorders, also genetic conditions, and chronic diseases like diabetes. Symptoms of liver and kidney dysfunction can overlap and may include what our patient was feeling, that was fatigue, and changes in volume of urine or color, jaundice, and gastrointestinal symptoms. Liver and kidney dysfunction can lead to serious complications, including cirrhosis, hepatorenal syndrome, and end-of-stage renal disease. Accurate diagnosis requires a comprehensive medical evaluation. We would still have to consult with our dietitian and other doctors to complete this diagnosis. Treatment for liver and kidney dysfunction depends on underlying causes, and most of them include lifestyle changes. A healthy lifestyle is a healthy person. Reducing the risk of liver and kidney dysfunction also include a healthy lifestyle and managing liver and kidney dysfunction also requires a multidisciplinary approach involving hepatologists, nephrologists, and other healthcare providers. Okay, so lifestyle changes for a healthy future, a diet plan, an exercise plan. We recommend daily recordings of blood pressure and weight to see how the patient is progressing, periodic testing, and that includes lab testing, in person evaluation, so on and so forth. And then we added this the patient is more than welcome to get a second opinion if warranted. Here I took the liberty of providing a follow-up, so everything is going to revolve around the patient's PCP, primary care provider, to evaluate and treat. The PCP recommended a registered dietitian as well as a sports medicine. We're going to go ahead and add in labs, sleep clinic, psychologists, physical therapist, and gym program.